Today, I really want to draw your attention to the signs and symptoms for pancreatic cancer. Unfortunately, when there's a problem in the pancreas, it's often a very quiet problem to begin with, and you don't generally have a lot of symptoms. And this is particularly true for a pancreatic cancer. Pancreatic cancer would be seen as quite a secretive cancer. So here's what I want you to watch out for. Vague abdominal symptoms, or even vague back problems. And by that I simply mean maybe you start to just not feel quite right after you've eaten what you would normally eat in a day. So that could mean that in the evening you're maybe a bit more bloated than you would normally be, or you're a bit more full of wind. Anything like that, that at first you're tempted just to put it down to, oh, it's something I've eaten. Just watch. Just make sure that it does settle within an appropriately short period of time, say maybe a week. If it goes on for more than that, maybe 2 weeks, then seek help. Now you can go to your pharmacist to begin with. It could simply be that you really do have indigestion, or maybe you have a wee bit of an upset stomach from a bit of a virus or a bug. So go to your pharmacist to begin with and get a bit of help from there. But if this problem persists, please go to your GP. So when I say vague abdominal symptoms, I'm thinking of indigestion, a bit of heartburn, the bloating that I've already mentioned. Even if, and it's not a very nice subject, but if your poo doesn't seem quite right, maybe it's a bit paler than normal, maybe it's more difficult to flush away, maybe it's a much worse smell than it was before. Those are the sorts of alarm bells that I want you to listen to. Don't put them to the back of your mind. Other symptoms can be even more vague than that. You can feel maybe a bit down without a good reason, or you can feel more anxious and more uptight than you would normally feel, and you're not able to explain why. Again, don't dismiss that. If that continues on for a week or two and you really can't put your finger on why you feel that way, again, seek help.